everyone. I'm Dr. Ellie, and I'm here with my podcast, I Heal Kids. And if you don't know me, I take care of children 0 to 21 with holistic pediatrics, blending conventional medicine and alternative medicine all into one. And I also do functional medicine for kiddos 2 to 102. So if you need any of that, definitely reach out on my website, middlepathintegrativePediatrics.com. Also, if you don't know what functional medicine is, I have a ton of pods on that, which we'll link in the show notes. So definitely check those out. I am so excited today because I am here with my friend Troy, who is an amazing prenatal yoga teacher. So welcome, Troy.
Thank you. I'm happy to be here, Ellie.
Me too. So Troy is, like I said, a yoga teacher. She's also a retreat facilitator who specializes in helping mothers, which I know all y'all are mothers. Well, I do have some dads too. Connect with their strength, ease, and joy, which is amazing. She's been practicing yoga since 2006 and teaching since 2010. And Troy, and I know this to be true, brings a playful, nurturing, and empowering presence to her classes. She is a self-described perfectionist, but she has found peace through yoga. I can certainly relate to that. And now she's passionate about helping mothers feel good about their bodies, clear their minds, and be confident in their abilities, as well as be connected to who they truly are, which is so amazing. I love that so much. I feel like I connected to yoga through that as well. Maybe not so much well, I guess it was a combination of like perfectionism and anxiety driven by the perfectionism, and then dropping into yoga and being like, oh, I just have to like breathe. This is amazing. It's so good for like regulation and all of that.
Mm.
Well, I would love it. So I did introduce you, but I would just love it if we could just kind of jump right in and you could introduce yourself a little bit more and just sort of tell us like, what inspired you to practice prenatal yoga? What has your journey been like? All of that good stuff.
Yeah, thanks, Dr. Ellie. Thanks for the great introduction. Well, my name is Troy, as you already said. I live in Asheville, North Carolina, but I've just been here for a couple of years. I was in the Bay Area of California before here, and that's where I got into teaching prenatal yoga. I first took a training not like on a whim, but I didn't know how into it I was going to get. I wanted to learn how to teach prenatal yoga. I had sometimes prenatal students coming into my regular classes and I didn't really know what to do with them. I kind of would just tell them, I'm sorry, I'm not really trained. I think you're not supposed to do twists. And I didn't really know what else to say. So I took this training with Jane Austen in San Francisco, and I just think she's the best and a really inspiring teacher and so enthusiastic and passionate. And she used to be a midwife and she was a doula before that. And I just got so much knowledge and so much inspiration from her from that training. And after that, I read Ina May's Guide to Childbirth and then I just got like obsessed with learning about childbirth and pregnancy and postpartum. And so that's how I got
Yeah.
into it. And I feel really lucky that I was teaching at a studio that let me teach a prenatal class right after I finished my training. And I just kind of fell in love with not only the yoga itself for pregnant people, but the community that feels like it's really easy to build around pregnancy when you have a group of pregnant people coming together. And so I think that might be my favorite part is the community aspect of prenatal yoga in a group class.
Yeah, I can definitely attest to that because I have been to one of your classes and it does seem like just having a chance to connect with like other pregnant people and just sort of talk and be like, oh, you're going through this and that too. I totally am as well. And just kind of knowing like, whether or not it's kind of a normal thing and like kind of sort of connecting. And I think also it's just nice as far as like not only creating community like in the time that a person is pregnant, but also like for delivery, because those people that you've met are going to be in the same like life stage. So it's going to be like, okay, now we're in the newborn craziness. Now we're at 6 months, we're starting solids. Like everyone's kind of in that journey together, which is pretty amazing and pretty cool. Yes. And I also can relate. A lot of people don't know this, but I did my yoga teacher training like years and years and like eons ago. And I have not done much with it other than I've like volunteered and things like that. Or one time I did taught like an online class or whatever. But I had that same experience of like, oh, like, okay, pregnant people, like, not quite sure, like, just don't do anything harmful. And it's so important to really have someone that is truly, truly trained in that specific expertise versus just going to like a general class because there are a lot of things that are different, which is like, one of the reasons why you're so great and why your class is so amazing because you do have that knowledge. I was kind of wondering, like, could you go into just the biggest benefits of prenatal yoga for expecting parents? Like, how do people, like, how does it support physical and emotional well being?
Yeah, absolutely. So I will say this is all, my opinion and my take on things is so for one, I already touched on the community. I think pregnant people need to know that they're not alone and that, yeah, there are other people going through similar things or different things, but there's a place to talk about it because maybe they're going just to their normal job, they're going to work, they're going to places where people might not even know they're pregnant
Mm,
or they might know, but I don't know, they might not have something to say about it. And so being able to connect with other people, I think is really invaluable. Um, that being said, you might not always be doing yoga in a group class. Maybe someone's taking a private class or doing some yoga on their own. And there's still a ton of benefits of prenatal yoga. There's, of course, muscle tone. There's creating flexibility in the body. There's, depending on how the teacher is teaching, there can be some childbirth preparation included. I love to include some pieces of education around childbirth in my classes, and there's a lot of hip opening and helping people ease back pain, which are some of probably my most requested parts of the body that need attention during pregnancy. And of course, there's just also the calm, the relaxation that not only helps them feel better during their pregnancy, like today, but it can also help them prepare for their labor because if they know how to relax, it's probably going to go easier for them than someone who only knows how to like hold tension and go, go, go and kind of not be able to find that calm and peace, even
yeah.
in intense situations. So those are some of the benefits.
Yeah, I mean, that's really truly amazing. I was just talking to a pelvic floor physical therapist yesterday, and she was commenting on that a lot of us really can't even feel our pelvic floors. And I was like, that is so true. And I was kind of thinking about it because she was like, okay, well, like take a deep breath. Like, do you feel your own pelvic floor? And I was like, you know what? I actually do. And it's because of all the yoga that I've done. And that's like that I think is how I've learned to be in my body more and also like determine whether I'm holding tension or not. Because I think in the past, I might not have even known if I was feeling stressed in my body. I would just be like, go, go, go. And I am a very driven person, no surprise. So, there is a part of me that needs that like downtime and that breathing time and all of that. And I think like also true when you're a pregnant person because it's not as if your personality completely changes when you're pregnant. So I would imagine for myself that I would still be trying to go, go, go and not learning how to like relax like the hip or the back or prepare the pelvic floor for birth in those ways. And I know she talks a lot about also like strengthening aspects for people who are super bendy. So it kind of goes both ways with the strength and the flexibility together as opposed to just like one or the other, which is so interesting because I feel like the middle path, see what I did there, is often the way.
Yes, absolutely. The person who I trained with, she says we want our muscles to be strong and supple. We don't want to be weak, but we also don't want to be like strong like iron because, well, for one, it's not going to help your baby move through you and out into the world if your muscles are super rigid.
Yeah, I think like isn't there's like that analogy of like the tree blowing in the wind versus like a branch that's gonna break that's really rigid. I think so. Yeah.
Yeah.
I love that. So like just for people out there that are maybe like newly pregnant and have never been pregnant before, or maybe never even gone to a prenatal yoga class, how does prenatal yoga differ from just regular yoga? Which I know that's kind of hard because there's a lot of like quote unquote regular yoga, but like I think most of us kind of think about it as like a power class where we're doing like down dog and like vinyasas and push-ups and all of this. But what would you say? Like, are there any specific poses or breathing techniques for people that are pregnant?
Yeah, absolutely. I mean, and again, this is the way that I teach and the way I learned. I can't say that every class will be like mine, but the pace, it's all designed for the pregnant person. So prenatal yoga, the way I teach, the way I learned, is not just a regular yoga class with maybe a few poses taken out that they're not supposed to do. It's completely focused and centered on the pregnant experience of what the mind is going through, what the body is going through with changes. So we do breathing exercises to help calm and relax. And those are breathing exercises that can translate into bringing with them to while they're laboring and practicing them during their labor to help them relax, to help the pelvic floor soften and relax. And so this also looks like a lot of hip opening. We do a lot of hip opening. We do poses that are strong to help them really find their strength, find their center, find their power, because they're going to probably want that during their labor, during the birth of their baby, and during motherhood. So I like to include some strong poses. And we also do focus on creating a generally relaxed environment overall and making sure that there's plenty of time to rest. And the way that we move through the poses is also more deliberate. I think the way we move through the poses is a bit more deliberate than other classes where there's quick transitions from pose to pose, because that just helps take care of the pregnant body, that they're not going to tweak something, and so that they can practice, like you were talking about, just being in their body, becoming more aware of their body and present.
Yeah, I think like I would say your class is like very considered. It's kind of like everything's there for a reason. There's like a purpose to it. There's, there is that time to decompress. And I think sometimes with not to say anyone's class isn't quote unquote good, because everyone's doing a great job as a yoga teacher. It's just that sometimes I've noticed that even on days that I am like a little bit slower in my body or I'm feeling a little bit more tight in my body, sometimes the transitions can be really, really fast in those Ashtanga and those like vinyasa classes where I'm like, oh my goodness, I wish I was still 27, but I'm not. And I just have to slow it down because I'm certain I'm going to injure myself. And I imagine like when pregnant, now you may be off balance or your hips are different, your center of gravity is different. There may be like hormones that are making you kind of loosey goosey. And now we're moving really fast, which may not be like the best thing during pregnancy. So I'm
Yes.
glad that you're taking that into consideration. Yeah.
Absolutely. And I fear mostly for the people who aren't like you, who's noticing it's too fast for yourself, but the people who are just gonna like do it and they're just going to try to keep up and then maybe accidentally hurt themselves. So yeah, that's why there's a lot of consideration into making it a good pace for hopefully everyone.
Yeah. Yeah, like 10 years ago, I would have been like, "No, I'm gonna keep up with everyone." But just over time, I'm like, "This is silly. Like, what like, who am I trying to prove anything to? Like, the person next to me doing down dog doesn't care, so why do I care?"
Yeah.
So speaking of, like, the specific poses and everything, like, what would be some, like, super safe, super beneficial poses for, like, common pregnancy things like back pain, swelling, nausea, all of that?
Yeah, there's so many. I love yoga for pregnancy. So some really simple ones are like cat pose for back pain, child's pose, downward dog. These are just really basic poses that people who have taken a number of classes would probably all know. For swelling, anything that we can elevate the legs. So if we can elevate the feet and the legs, I mean, usually I think that's where my students say their swelling is in the feet and the legs. And for nausea, honestly, I don't know what to do for nausea. I hear that moving in general is good to kind of help move the hormones through the body because a lot of times the hormones are what's causing the nausea. But I do know that there are poses that we won't want to do when we're pregnant. So skipping things like forward folds if they're bothering you. But there are some other common discomforts like just feeling generally crowded in their body. Sometimes I have moms come who are just like, oh, I don't have any more space. The belly's just, the baby's taking up so much space. And so yoga can also help create that feeling of space with certain moves like side bends and different back stretches.
Yeah, I hear that a lot. I'm obviously not an OBGYN, but I take care of a lot of a lot of kids of pregnant people. So people will tell me that like frequently that they just are like, oh my gosh, I'm just feeling like there's so much pressure like in the abdomen, pushing up on the diaphragm and all of that. So I imagine it's like such a relief to just kind of like open that up and just not have that. Because for me, at least, I feel like it'd be almost anxiety producing to not be able to like escape from it.
Yes. Yeah.
Yeah, and like nausea, I mean, I almost wonder about just doing like the traditional Chinese medicine points along the wrist. I'll link those, but like just like maybe like a little break with a little bit of acupressure. And then, of
Yeah.
course, ginger, like the ginger tea, but you can't really do that in yoga.
Yeah.
I mean, well, I
I'm
guess you could bring it, but
I'm sure everyone would love to hear those acupuncture points. Yeah, generally people don't really come to my classes if they're nauseous. It just doesn't really sound appealing.
yeah,
But there are a
probably
lot of
not.
poses because I've been teaching while I've been pregnant. So I know that a lot of poses actually do feel good. But if I wasn't teaching, I probably wouldn't be going to take a yoga class because it just doesn't sound good to be moving around
Yeah,
while
me
nauseous.
too.
Whether it's pregnancy or something else, nausea and like moving around doesn't usually sound very
It
appealing.
doesn't usually mix very well. No, not at all. Although I imagine like just kind of breathing, like the meditation and that might feel, I don't know, it might for some people might feel helpful.
That's true. I think you're right.
Your baby's birth should be a joyful experience, and with the right knowledge, it can be empowering too. If you don't know me, I'm a holistic pediatrician at Middle Path Peds in Asheville, North Carolina. In this free webinar that I'm so excited to share with you, you'll learn how to make informed choices about newborn care, from eye ointment to newborn screenings to when to give baby that very first bath. We'll also go over reducing environmental toxins and supporting your baby with whole food nutrition, all to give them the best possible start. You'll leave here feeling confident and informed and ready for those precious first moments. If you want to nurture your body for a healthy pregnancy, feel empowered in your newborn care choices, and learn holistic ways to support your baby's health, well, then this webinar is for you, and I invite you to join. Feel prepared, feel confident, and feel ready for your parenting journey. So click to join us for the free webinar. I'll be happy to see you there. Well, like just to kind of shift gears, what are the specific techniques that help, like how can prenatal yoga specifically like help the mind and body prepare for labor and delivery? Like, are there certain things that would really like prep people or even maybe could be used during birth?
Hmm. Yeah,
Okay.
so I've touched on some of these already, I think, but there are different breathing practices. We do something a lot in my classes called the rose petal breath, where we breathe in through our nose and then we just open our lips ever so slightly, like we're holding a rose petal between our lips. And then we just let the breath out really slowly. It's so simple. Yeah, so that's one that people seem to like because it's calming and it is something that they can bring with them to their labor and practice that. Or sometimes people say they did a little more forceful version of that during their labor.
Yeah,
And
I
so,
imagine.
yeah, people can make it their own, but if they feel comfortable enough using some breathing techniques, that's really helpful in preparation. And also, I touched on this earlier about how I like to include some strong poses in my classes. I think feeling their own strength, having pregnant people know that they are strong, they are powerful, they can do this thing even if it's hard and even if they want to give up. So that is a good preparation for labor, I think. And also helping people understand, this gets a little bit more technical, but the way that the pelvis moves, you know this, the pelvis is mobile in a lot of different ways. And there are certain positions that when we get into that position, it helps to open the pelvic inlet. So the first hole that the baby's going to go in through.
Yeah.
And there's certain poses that help to open the mid pelvis. And then other poses help to open the pelvic outlet. So for
Mm,
someone who can understand, this isn't like a total mystery of like the baby's just going to come out when it's ready, but this understanding that the baby is in relationship with the pelvis, with the bones, with the muscles. And if they or their care provider can help them understand where the baby is in relation to their pelvis, they can actually use certain poses to help bring the baby down and out
mm,
through the passageway of the pelvis. So that's
yeah.
something that I love. And I feel like a lot of people don't know that. It's just a little bit mysterious, but it's just our physiology, and it's just understanding how the body works.
Yeah.
So that can be a big help in preparation for labor if people are willing to learn that, or even just to learn like one or two movements that they might remember during their labor.
I love that. I think that's amazing. It's like, how can we move the, like, for lack of a better word, like the little cage that's around the baby, like of the bones and the muscles and the fascia and everything, like how can we move that so that the baby themselves can flip into hopefully head down, vertex positioning that's like more optimal without having to necessarily do like a manual. Forgive me, all the OBs who do it, but I think it's an eversion where you like spin the baby around. I think that's what it's called. And maybe there's some evidence, I'll have to look, for doing yoga and then the baby coming into the birthing position. That's amazing. I love
There
that.
absolutely is. There's so many movements that are helping to balance the body. I would say spinning babies is the best resource on this. I've taken some trainings with them, and they're all about just, yeah, how do you help the body be in balance so that the baby's more likely to be head down, kind of
Mm,
from the start, or not from the start, but when it's relevant for the baby to be head down towards the end
yeah.
of the pregnancy, and then how to help them navigate the pelvis on their way out.
That is so cool. So like, are there, like, could you share any, like, are there any like specific poses that would be like people who've done yoga before maybe would recognize if you named them that would help with stuff like that?
Yeah, so something really simple is like tucking the tail under. So whether you're standing up or in a tabletop pose, if you're tucking your tail under, like tailbone downward, that's helping to open the pelvic inlet. So that's helping to open the
Okay.
top of the pelvis. And then just vice versa, the other direction when you're tilting the pelvis the other direction, like I've heard teachers say, like, lift your tail feathers. If you imagine like lifting up your tail feathers, whether you're
Yeah.
standing or in tabletop, is another nice position to kind of feel that change, that tilt of the pelvis. That helps to open the pelvic outlet. So lifting the tail feathers helps to open the pelvic outlet.
Oh, I love that. I'm doing it right now for people that don't know because you can't see me. And I really do feel the opening. Like it's kind of wild. Like you wouldn't think it. Troy, I wanted to circle back and just ask you, for anyone who's like terrified that you're going to ask them to do a handstand as a strong pose, what do you mean by strong pose? Because I could see people being like, wait, what do you mean? I'm not coming in for those handstands, Troy.
Yeah, I've never taught a handstand to a prenatal class. I will say that. No, I'm talking about like holding some lunges, holding some warrior two poses, or we do some poses where we lift our arms up and we hold them up for a long time. So we'll like hold our
Okay.
arms up, and it gets really hard. It gets really hard to hold a pose like that for more than a couple of minutes, really more than 1 minute for most people. So that's something that we'll do and stay here for maybe 5 minutes and
Wow.
practice relaxing, practice finding your calm. Notice what thoughts come up in your mind when you stay here. Is it like, oh, this sucks, or I can't do this? Because maybe those are the thoughts that are going to come up during your labor. And then how do you be with those thoughts, and how do you move forward and continue returning to remembering that you are strong and you can relax?
Yeah. Yeah, I feel like that benefit would also translate to the postpartum period because it is exhausting, it is tiring, whether you're breastfeeding or bottle feeding, the baby is up. There's so much going on, hormones, like the milieu of like hormones, exhaustion, the baby having needs, and just like your own recovery is like enough to break anyone. So, like, to all the birthing people out there who've had kids, like, that you are amazing just for doing that because seriously that I would probably be, on a beach in Cancun like for 2 years after that. So, goodbye Dr. Ellie's practice, but it is truly like trying. And I think being able to regulate in that way, and a lot of people don't know this, but your own regulation translates to the baby's regulation. And so having that parental dyad be in regulation, it doesn't mean at all times, 100% all the way. But when one party is dysregulated and then the other party becomes dysregulated, it becomes a positive feedback loop. And it's really hard to bring the whole situation down. So I do agree. Those skills are like really beneficial. But, like, specifically with, like, postpartum, just, like, recovery itself, especially, like, if you've had well, I guess really either if you've had vaginal or a C-section, I mean, I think that yoga would have benefits. Like, what would be some advice that you have or benefits that you see around postpartum recovery? And, like, when can someone safely resume a practice?
Yes, absolutely. I love postpartum yoga. This is something that was included in my prenatal training that I took. Specifically, we would do a lot of parent and baby yoga, but I think that it is an excellent support for people post birth. I always recommend for people to get an okay from their care provider, from their doctor or their midwife. Usually it's around 6 weeks. Sometimes it's longer. Sometimes it's often longer if they've had a C-section. And then once they have the okay, returning to yoga can be really helpful. Just again, like prenatal, there's the muscle tone. But for postpartum, it's a lot of like, how do I regain my strength? Especially people are concerned about regaining strength in their core and in their pelvic floor. So that's something that I usually focus on in those classes. And again, if it's a group class, it's a great way for people to find community because maybe they're home all day with their baby and they love their baby, but like they don't have adult thoughts and conversations, and it can get very, very monotonous. And so it can be
Yes.
a space for people to connect with each other and remember that they're not alone and get moving. A lot of times people they just want to get moving and maybe they're unsure about what they can do safely. And so when they have a prenatal, postnatal teacher who is well informed about what they can do, they can just relax and follow along, and they don't need to wonder if they should be doing this or not.
Yeah, I think that's pretty amazing, especially around like the relaxation part, because I do think how do I want to say this? While you may be tired all the time, I don't know that there's a lot of opportunity to just relax, especially with feeding and all of that. And just having like a moment for your brain to just like calm down, your parasympathetics to kick in, your vagal tone to increase or become toned, however you want to say that. It's like just being able to clear it out for a second and like get back to yourself and recognize like, oh, I am like a actual human. I'm not just like a feeding machine. I think is so valuable.
Yes, yes,
Yeah.
absolutely. Taking those moments to be present, to feel their own body exactly as their own whole person that isn't just the feeding supply.
Yes.
Yeah. It isn't just the caregiver, even though they are that.
All the things all at once
Yeah. And
as
there's
life
also
tends to
there
be.
there can be also a lot of like sitting, sitting and nursing, sitting, feeding their baby in whatever way they're feeding them, and they'll also just need some stretching. Just need to stretch, continue to create
Mhm.
more flexibility in their body so they can be more comfortable. It's like it's it's not just about like, oh, I want to be more flexible. It's like, oh, I don't want to have back pain. I don't want my shoulders to be hurting all the time. I'm like always rounded because I'm always holding my baby. And so how can we open up those parts that get tight and cranky?
Yes. Oh my goodness, such a plug for curing, what do they call it? Nursemaid's wrist. If you
Right.
haven't heard of it, it's an actual medical diagnosis from holding your baby. I think that's what it's called. Anyway, if you're an OBGYN or family doctor or something, correct me, but I think that's what it's called. But it's like a condition you get from holding your baby while breastfeeding, and it's painful. So if you can stretch, I mean, maybe that will help prevent. I want to ask, like, so a lot of people might be like totally new to yoga entirely, and have never stepped, a foot in a studio, and it might be a little intimidating. At least, anything you do that's new can be intimidating. What advice would you give? Like, what should people do? What should they wear? What should they bring? What should they not do? All of that.
Yeah, I love having students come for the first time when they're pregnant because I think it's just such a great time to step into the community and try it out. And like I mentioned, at least the way I teach, the classes aren't super fast, moving from one pose to the next, and there isn't a focus on like crazy fancy poses. It's really about like what's going to make you feel good today. So I think it's potentially a less intimidating environment to step into than maybe a really hardcore regular yoga class. Wear whatever you're going to feel comfortable moving around in. And what was your other question about this?
What to not do? Like, are there any no-nos or anything that would be like outside the norm for a prenatal yoga class?
Do you mean if they came to a prenatal yoga class and they didn't
They're
feel
just like,
comfortable doing something?
yeah, like, you know, I guess what I'm trying to say is, let's say you came to a class and you started doing things that maybe were not appropriate for the class, like doing handstands and like knocking people over. Like, is there anything that people should not do?
Don't do handstands and knock people over. I feel like if you're following along with what everyone is doing and what the teacher is offering, you're not going to do anything wrong, just being respectful.
Yeah.
Yeah.
I love that because I do think there's like a lot of barriers that we put on ourselves, like, like fears around like, oh my gosh, like I'm not the most slender because, we all have these like, well, maybe not all of us, but many of us have like these thoughts, like, what if everyone's like in a crop top and like spandex and like I'm gonna be the only one in my t-shirt. I don't even own yoga pants. Like there's all this like mental junk that goes through our minds, and like we're going to be the only ones that don't know what we're doing, and like we're not flexible and all of that. And like the truth is, at least in my experience, it's not like that at all. Like you can come as you are. You are going to be fine. You have a great teacher, especially with Troy, who's going to help you if you're ever confused, which you probably won't be because she's going to walk you right through it. And you really like just have nothing to fear at all. And it's such a benefit, not just to the pregnancy, but a lot of people don't know this, to the baby's health after the fact. So there's a lot of research coming out about how stress is affecting the actual baby and affecting their DNA. And so even doing some of this stuff in advance can really help with your baby's outcome as well. So I love
Yeah.
that.
Yeah. And I will say that I hope whoever tries yoga for the first time has a good experience. And if you find yourself in a class and the studio doesn't feel comfortable for you or the teacher doesn't feel like a good fit for you, I really encourage you to try another class or try another studio. I've taken hundreds and hundreds of classes, and I will say it's really rare, but once in a while, I find a class that I don't like or a teacher that I don't jive with. And I'm always so grateful that that wasn't the first class that I ever went to, because if it was, I might have never gone back into a yoga class again. But luckily, I had a really great teacher and a really nice studio for my first class that helped me to feel comfortable and welcome. So,
Yeah. Yeah, that is so true. It's like any profession. There's just people you drive with and people you don't, and ways of being that you're like in line with or aligned with, and then other ways where you're like, well, this wasn't really like for me. So
Yeah,
yeah,
I've had a
definitely.
couple classes that I just left in the middle because
You
I
did?
just didn't, I really didn't like it. It was a really, they were like really hot classes too. So I was really uncomfortable. And I just said, sorry. I just waved, I just left and I didn't force myself to stay because it wasn't,
Yeah.
it wasn't good for me. So don't
I
feel
have
like you
tried
have
hot
to
like
stay.
yes, I have tried super hot, not just like warm, but like hot yoga before. Oh my gosh, I did it twice and both times I was so nauseated and so sick. I mean, I have to say that I did not leave and should have, but I was like in child's pose, just like sweating, like, why is this happening to me? And I don't know, it wasn't for me.
Yeah.
Troy, where can people find you? If they want to learn more, or like where can they attend a class? How can they work with you? And then do you also do postnatal and prenatal? Like what is your range of classes?
Yes, I teach prenatal and postnatal yoga, and I teach vinyasa flow classes. So if you're
Ooh.
beyond the stage of postnatal and you want a vinyasa class, I teach flow classes as well. You can find all of my current offerings on my website. That'll be the best place to look. So my website is troymarjenhoff.com. So my name isn't the easiest maybe to spell, but it's just www.troymarjenhoff.com. So you can find all my current listings there. I do teach in person in Asheville. I teach a lot of virtual classes as well. So, and I
Oh,
also
that's
have a couple
super.
of mini retreats for moms coming up if you're listening
Ooh,
to this in real
mini
time.
retreats. When's
Mhm.
the next mini retreat for people who are listening in real time?
The next mini retreat is on June 8th.
Love that. Is it in Nashville? Where's it at? What's the
Yes,
deal?
it's in Asheville. And then on July 13th, there's a virtual one for people from out of town.
And is it for all people or pregnant people?
It's for moms, and it can be if you're pregnant with your first child, you're also included in this group.
I wonder if you'll ever do a group for those of us that were not able to have children, the non-mom moms,
Yeah,
those of us who care for other people's kids.
I
That
would
would be
love
so
that.
amazing too. Yeah. But I love that you're doing it for moms, and we'll definitely link it in the show notes. That's so good. So I think we're going to wrap it up there. Are there any final thoughts that you want to share?
No, thank you so much for having me.
You're so welcome. And you all, again, if you don't know where to find me, I'm at Middle Path Integrative Pediatrics in Asheville, North Carolina, and I'm a holistic pediatrician taking care of kids 0 to 21, blending conventional and alternative medicine. And I also do functional medicine for those of you who are 2 to 102. And I hope you found this so valuable. And if you haven't thought about prenatal yoga before, definitely check out Troy's stuff because she truly is amazing. I have attended and she's just super good at what she does. All right, wishing you guys well. Bye. Your baby's birth should be a joyful experience, and with the right knowledge, it can be empowering too. If you don't know me, I'm a holistic pediatrician at Middle Path Peds in Asheville, North Carolina. In this free webinar that I'm so excited to share with you, you'll learn how to make informed choices about newborn care, from eye ointment to newborn screenings to when to give baby that very first bath. We'll also go over reducing environmental toxins and supporting your baby with whole food nutrition, all to give them the best possible start. You'll leave here feeling confident and informed and ready for those precious first moments. If you want to nurture your body for a healthy pregnancy, feel empowered in your newborn care choices, and learn holistic ways to support your baby's health, well, then this webinar is for you, and I invite you to join. Feel prepared, feel confident, and feel ready for your parenting journey. So click to join us for the free webinar. I'll be happy to see you there.